Now, the news comes as more of Long Island's frontline workers qualify to get the COVID vaccine and roll up their sleeves. We have team coverage of this very busy day in the search for a cure for you. And we begin with our Eileen LaPalmer.
We have no information as to where to go.
Today is the day that the next round of people should be getting the COVID-19 vaccinations. But Dr. Kerry Fierstein, the CEO of Allied Physicians Group, says it's a mess.
We've been passing around information like an underground, something on Facebook. Here's a site, I think I heard.
According to New York State, the people eligible for vaccines as of January 4th are all outpatient healthcare workers, registered nurses, doctors who work in private medical practices and their staff, as well as physical therapists and their staff, and dentists and their staff.
Everybody is saying that this should have been the easiest group. Right? We're a captive audience.
This is a full court press to mobilize our resources.
To try to smooth out the process, Nassau County Executive Laura Curran announced that starting tomorrow, Northwell Health will begin operating the island's first vaccination distribution center at Nassau Community College.
Our role is to coordinate the vaccination process, working with everybody else in Long Island, and that means working with every other hospital, working with government.
And Governor Cuomo also called out local politicians, urging them to make sure that hospitals are distributing the vaccines that they have.
I need them to take personal responsibility for their hospitals. This is a management issue of the hospitals.
Laura Curran's picture was among those that the governor showed, as a chart indicated that Nassau University Medical Center has only distributed 19% of the vaccine doses it currently has. Curran at a press conference pointing out that the county does not run NUMC. However, the county executive does have to approve the appointment of the hospital's CEO.
What kind of response have you gotten from the board of directors?
So over the past few days, I've asked them for their plan of action and let them know that our expectation is that we get this vaccine distributed as quickly as possible.
And have they not given you their plan?
We're working on it.
And the Republican presiding officer of the Nassau legislature issued a statement saying in part, quote, the county executive can try to distance herself from NUMC, but she needs to light a fire under the chairman of the board, whom she appointed to run NUMC.
I'm very surprised that New York didn't have a better plan.
In Mineola, Eileen LaPalmer, News 12 Long Island.
Now, we reached out to NUMC to find out what caused the delay in vaccine distributions. A spokeswoman says she would send a statement, but so far they have not answered our questions.
All right, so we're asking this question on our Twitter page. Here it is. Are you satisfied with the speed of the COVID-19 vaccine rollout in New York? You see the response right here. 71% of you who responded say no. Only 11.8% say yes. 17.2% not sure about this. If you'd like to weigh in, visit the News 12 Long Island Twitter page.